The Tasmanian coroner is telling the state's medical fraternity to be vigilant after investigating a series of cases where a person has died because sepsis wasn't diagnosed early enough. Coroner Rod Chandler has published findings on 2 deaths that occurred just hours after the patients were discharged from hospital. He's found at least 3 Tasmanians have died after doctors failed to diagnose infections since 2010.
Christine Ann Inches died about 10 hours after being discharged from the Hobart Private Hospital. Coroner Rod Chandler has found the 59-year-old should have been diagnosed with sepsis, a bacterial infection of the blood. Mr Chandler says an early CT scan would almost certainly have identified a perforated bowel and the urgent need for surgery. The coroner says, had these steps been promptly taken, Mrs Inches had an approximate 75% chance of surviving her sepsis.
You can't comprehend it, and it's not anything that you can kind of move forward from because there's all these what-if questions.
The coroner wants the medical fraternity to be vigilant, citing a series of deaths he's investigated where sepsis wasn't diagnosed in time. That includes a 72-year-old man who died in 2013, 13 hours after being discharged from the Royal Hobart Hospital. In 2010, Joanne York died from sepsis leading to organ failure, 10 days after undergoing gastric lap banding at the Hobart Private.
These tragedies can unfortunately occur and are more likely to occur in situations where the emergency department staff are under stress.
The Australian Medical Association says doctors know sepsis is difficult to diagnose.
So there are a number of conditions that can present with, for example, a fever or a high pulse rate.
The Hobart Private Hospital says policy changes have now been made around sepsis diagnosis and treatment. A health department spokesman says the Royal Hobart Hospital has updated its sepsis checklist for staff. Ellen Coulter, ABC News.